And now advice as you age. Many times as you get older, it's hard to keep up with staying fit and strong, but maintaining your strength is vital. Joining us now is Carolyn Richardson and Chris Sear, and they are going to tell us what we can do. Thank you both so much for being here.
Thank you for having us.
Yeah, well, Carolyn, let's start with you. Should we consider debility a normal part of aging?
Absolutely not. Although aging is a natural process, weakness and decline in strength is not normal, especially if it's quick. It's happened quickly. A gradual decline as we age, exercise, general lifestyle of exercising and strengthening is important. However, if there's been a quick decline, that's when we want more intervention with regards to maybe home health or some kind of a rehab. Okay. So we don't look at it as normal.
No, that's a good point, is be careful and watch the speed at which you are getting this debility. Let's talk about options and what's available for people to combat or help strengthen, particularly after a recent quick decline.
So there's a few different spaces. The first one I would say is your post-acute rehab hospital, which is intense therapy, 3 hours a day. There's also your skilled nursing facility. Generally, at discharge, whether it be from a hospital or those two spaces, you would have home health with physical therapy and rehab in your home, and then possibly transition to outpatient therapy.
Now, how do you know if you need it or not?
Well, I'll actually let Chris answer that question.
Yeah.
He's our guru.
So in a home health situation, what we're primarily looking at is how people function in their home. Most of the people, we want to look at their prior level of function. If they were functioning independently prior to their hospitalization, then our goal as a home health therapist or a home health agency is to get them back to their prior level of function. So if they have weakness that's preventing them from doing those things that they would normally do, then it's our job to come in and help them get back to their level that they were functioning at.
And let's talk about some of the things you do. What does home health physical therapy provide, or what does it look like for a patient?
So when we come into the home, of course we have the whole medical history, but we want to look at a few things. Number one, we're looking at home safety, and then also we want to we assess the ability for the patient to function within their home. Is it a safe environment? Is there adaptive equipment that's needed? And then make that a functional assessment where we're assessing their strength and their balance, and then coming up with a plan of care to help them to ultimately achieve the goals of being independent at home again.
Because there's a lot of beneficial therapies for patients.
Yes. Like I said, primarily in a home health setting, we're looking at their function, their independence in the home, fall prevention, and restoring their balance and strength, so that they can get on and off the couch without needing assistance, or in and out of the shower without needing assistance, and being able to do those regular activities of daily living without having to call on somebody.
Yeah, you want to be independent, which is important for people at home who have noticed this. They want to get help. How can PACE help, Carolyn?
PACE can actually have a PACE care coordinator do a quick assessment. Perhaps if they're in the home, visit them in the home, and then reach out to their physician and get an order to get home health started.
Yeah, what's great is you can go and determine the needs, right?
Absolutely.
That they need, and then you can work with them on evaluating what options, what things you can try.
Any resource. If we're finding they need more than just home health, we can help pull in all the resources they need to be successful.
Excellent. Thank you both so much for explaining this to us. We appreciate it. And for more information, to get the help that you need, to find out, if you need any of these therapies or what you can do, all you have to do is start here, seniorhousing.org, or call the number on your screen.